If you ask 7 dentists, you'll get 12 opinions. You see what I mean? Right? So firstly, okay, you must appreciate that there are so many opinions out there. Every dentist will give a different opinion, which is absolutely mad to just remember. But then remember that when a patient comes to you, they are coming to you, they're seeking your opinion. They've selected you either by geographical convenience or recommendation or whatever. They're now ended up in your chair, right? So all you're ever giving them is an opinion. That's it, okay? Here's a stupid thing, Nav, right? You say to the patient 120, and they're still gonna be like, oh, 120, that's too much, right? Yeah, and they didn't even know that was 150. You discounted it. The worst you could do is you give a discount, but the patient never knows that you got a discount. That's the worst thing. That's the stupidest thing ever.
Oh, I'm with you.
Patient communication is one of those things that you just don't get taught at dental school, like a few other things. Again, not their fault. We always talk about it never being the fault of dental school. They just need to make you a safe beginner. But the kind of things we worry about once we qualify is how do we actually make a connection with the patient? How can we communicate fees with the patient? And just how do you communicate the patient's options without coercing them into a particular treatment or trying to be salesy to a patient? These are all things I cover with Naveed Bhatti. Now, Emma is doing her finals at the moment, so we wish her all the best. You got this, Emma. But I tell you, this episode really packs a punch. We talk about body language, we talk about building rapport, we talk about patients that you just won't get along with and how you should manage those. And how over time, your patients become a reflection of you. And interestingly, we also discuss your money mindset. It's actually important when you're communicating with fee-paying patients. Hello, Protrusive. I'm Des Galati, and welcome back to your favorite dental podcast. This is the student arm, but I tell you, these episodes are not just for students, especially this one. Anyone who's struggling with communicating fees to patients or anything around being a more effective communicator, I really think you'll gain a lot from this episode, so make sure you listen all the way to the end. This one is eligible for CPD or CE credits. There's only one place you can get that, and that's on Protrusive Guidance. Please do download the app on iOS or Android store, but to actually make an account, the best way to do that is on the website. That's protrusive.app. You can try one of our paid plans, and I'm convinced you will love being part of the nicest and geekiest community of dentists in the world. Let's now join Nav, who's a dental student in Slovakia, as he asks some truly wonderful questions around patient communication. Catch you in the outro. Naveed Bhatti today is filling in for Protrusive student. Emma is doing her finals as we speak right now. But excited to grow this with you as well, my friend. Just remind everyone about yourself, my friend.
No worries. I'm trying to fill in for Emma for now, which is huge boots to fill. By myself, I'm a 4th year dental student in Slovakia, of all places, which is a 6-year course. So I'm not quite at my penultimate year, but we're almost there. So it's going quite well.
And if anyone hasn't listened yet, we talked about your journey, right, in a previous episode, and that was really cool. You inspired a lot of people. So please do listen to his backstory, how you went from country to country. And finally, you're still a little bit, few years away still, but your enthusiasm, your passion, your drive is amazing.
Thank you, kind sir. Thank you. A lot of it I must thank sort of Protrusive as a whole community, your podcast. It kind of keeps myself and my colleagues sort of kicking, inspires us on a daily basis. I'm not just saying that for the sake of it. It genuinely does. To see so many people out there supporting us on our journey is just amazing.
And it's been nice to also see your contributions on the Protrusive app. Like you took out some teeth recently, you saw some surgery recently, and you're posting about that. So it's great to have your input from your student viewpoint. And of course, today, probably in the title, this may not even be a Protrusive student episode because communication is communication. This is like the biggest thing in dentistry. Is far more important than your clinical skills. I'll just say that right off the bat. Far more important than your clinical skills. So I'm excited to record this episode with you today. And just any questions that you have in this sphere and to take it. So Nav, take it away, my friend. How can we help?
For sure. I think communication obviously is huge, as you quite rightly said, but for some weird reason, it's just never taught at university. You get all this theory, you get all this clinical kind of like workload, and they teach you how to do fillings and extractions and whatnot, but they never really get you to communicate with the patient effectively. So this whole realm, I thought, who better to ask than yourself, and kind of drill into it. So I think to start it off as a question, what are the typical do's and don'ts as a top layer with patients when it comes to communication? And then I'd love to ask you more about sort of dental team and dealing with sort of tricky patients, but we'll get into it. But if you don't mind starting with that top layer, then we can go from there. That'd be great.
Okay, so I have read a fair few books about communication over the years. One of the first books I read is like The Power of Body Language or something like that. So immediately when you said that, the first thing that came to my mind in terms of do's and don'ts. So guys, like those listening and watching, me and Nav don't rehearse these questions that I don't really prepare for. I just let them come and we just talk about it in a candid way. So automatically the don't that I think of is you are like typing and your patient's talking, okay? Or even you're writing things, okay? And the patient's talking and your eyes are actually looking at the paper, okay? So then you're like, well, how do I record everything if the patient's talking? Well, we're at an age now. Maybe that was an issue a few years ago. Now we use AI. I use digital TCO. I use Dan to audio record, and my nurse as well. Okay. So before it was my nurse. Okay. So I would be heavily relying on my nurse, kind of being a typist, like doing a complete transcript with what the patient says. So I've got a record of everything there if I want to look at it again to like collect all my thoughts. But I'm really attentively looking at the patient and really making them feel like, hey, this guy really cares. He's listening, and don't interrupt. So to automate 2 don'ts of not to do is don't have your back to them. Don't have your eyes away from them. Keep your eyes to them. Face them, face them front on. And what I also want you to do is make sure you are genuinely an active listener and not really listening to respond. Because there's some sort of stupid stat whereby a dentist on average will interrupt the patient in the first 5 seconds of them talking.
Oh. One thing that I've got right, which, you've definitely hit the nail on the head there in terms of interrupting, but I feel as though this is also linked to confidence almost. Now, forgive me if I'm wrong here and correct me if I'm wrong, but I feel as though I probably do it, and a lot of my colleagues do it, that when we do have the opportunity with a patient, we kind of blurt. And is that a confidence thing? Because we're trying to like collect all of our information, everything that we've been taught, and then we're trying to diagnose and we're trying to do everything at once. How do you like put that in the back of your head and just relax and ease? And as you said, just listen. Because there's been cases, I'll give you an example, like there's been plenty of times where a patient will say something and immediately your head as a student says, oh, is that irreversible pulpitis? Or I better start diagnosing it now, otherwise I'm going to forget. So then you start asking questions like, is it pain on, when you get cold stimulus? Is it pain when you get hot? It's like, shut up and just let them talk, right? But how do we as students kind of just ease off? Because it's so hard to do. But what's your best kind of advice for that?
My advice for you, Nav, is I think you're being very harsh on yourself, right? You are literally at a stage now where, just like you said, you're consciously trying to collect all this information. Like for someone who's got more experience, it just comes naturally because they've done it. They've heard the patient a million times talk about this. If the patient walks in, they know the diagnosis already, okay? So that is a very different position to where you are. We are actually actively learning still as you are still conversating with the patient. So it's very tough what you're doing actually, because you're trying to make the patient feel listened to, but at the same time, you've got this million thoughts in your head and you're trying to figure out, wait, am I off the mark here? Is this correct? What's the R stand for in Socrates again?
Exactly.
You know what I mean? So you're collecting your thoughts. So don't be so harsh on yourself. That's normal. And I think that will come with experience. The more you do it, the more slick you become, the more fundamental understanding of dentistry that you collect, your conversational flow will just come. And so I don't think there's a cheat code, except you got to do your reps. And so, but the thing is that you're up already because you're actively thinking about that. And the fact that you're already, you've told the universe that you care about communication, you want to become a better communicator, in time you will. I would say that now the best way to do it is maybe jot a few keywords down, okay? Because obviously where you are now, you're able to access the kind of things I've mentioned, but write a few keywords down, but really focus on being an attentive listener. Having said that, I said about not interrupting the patient, but do you know, Nav, what kind of patients will blabber and just talk and talk and talk and not give you, the dentist, a chance? Do you know what kind of patient?
That was genuinely going to be where I was going to segue into, because that is the next issue, is that if you shut up sometimes, they kind of feel as though I got to just keep talking. Because it's like the awkward silence, right? And it's like, who feels it? So what do you do with that?
Well, let's first identify a telltale sign. Okay, so when a patient is doing that and they've said their bit, but they're just going on and on and on and on, that is a classic sign of something. Okay, can you think of have you experienced this?
I'm going to say, is it anxiety maybe?
Absolutely, nailed it. It's anxiety, they're nervous, and they do that. So I've seen it time and time again. So if you recognize that, then sometimes what these patients, what they're really craving for, they're not telling you, is that, hey, I feel listened to, but can you just like take hold of me and just direct me? Okay, so for most people who aren't nervous, I mean, it's normal to be nervous a little bit at the dentist, right? But for those who have manageable anxiety, then what I recommended first is good. Let them speak and then have your thing. So ask open-ended questions first and then narrow in on closed questions. Okay, so questions that you're looking for a yes or no, that's closed. But how was your journey today is an open question. Okay, tell me more about your toothache. Okay, that's an open question. Whereas, is it the top left one that hurts? Is a yes or is a closed question, right? So you want to narrow it down. So later in the conversation, as as you're starting to nail your diagnosis and they've given you enough information to feed on. But if they're just going in a wayward direction and they're lacking structure and they're kind of crying out for help. And so sometimes, depending on your rapport with the patient and how you feel this will go, is sometimes saying, hey, patient, by the way, look, I'm going to just help to direct this conversation because I think we're really close now and I'm going to help you. Just remind them, I'm going to help you. But I just say, patient, how are you feeling? Are you nervous about being here today? And then sometimes they kind of like, yes, I am nervous. And they had the opportunity to just let you know about them. And then what they're craving from you at that point is say, hey, don't worry. Me and my nurse are really going to look after you. We're going to be really kind to you, and then direct them. I think that's a really nice touch to add to nervous patients.
Okay, and let me flip this for you. What about those that don't talk enough? How are you going to get that vital information extracted out of them? Because I'll tell you now, I've had that issue before. People just don't want to tell you anything. I sometimes look at them and think, are they just scared to talk to me because they don't want me to work on them? But surely you probably come across the opposite end. So how do you deal with kind of extracting information when you need it?
Listen, if the patient is not saying much, but they're saying with a few words they're saying, they're very impactful and you're able to nail your diagnosis and you have enough, and some people just aren't very talkative, right? And that's okay. And that's their personality type. Maybe they're a quieter individual, maybe they're introvert, and that's okay. But if you are still not getting enough, you then just need to probe more. And sometimes just give the silence and then raise your eyebrows and nod and invite them, okay? And repeat back what they said. So you said this, but can you just please expand more on this? Because I just need more information about that to get my diagnosis so that I can help you. So keep waving the carrot. I'm going to help you, okay? So that I can help you, okay? I just want more information. Can you tell me more about this? So you're still keeping it open-ended. Tell me more about this. But then eventually you can narrow into the closed-ended questions.
Okay, I love this idea of like the filter of start open and then just get to your target point. That's also, I'm going to actually start using that a lot. So thank you for that. More so with my colleagues and myself as I'm talking as a group almost. But we are, as a group, coming across a lot of patients that are beginning to, what we think, and this is assumption, not telling us the whole truth, right? And we don't know why. We kind of have conversed with each other and said, is it because they're scared because they don't want a certain treatment? Do you come across this? Is this like a common thing that people are not telling you the whole truth because maybe they don't want, an injection or they don't want a filling done? They're just trying to lie to us to get out the chair. How do you overcome that? Maybe clinically you've noticed there's something blatantly obvious, but then they're like, no, it's not painful. It's absolutely fine. But they're flinching on percussion, let's say, for example. How do you deal with that?
Yeah, that's a tough one. At the same time, you want to be respectful to the patient and you don't want to disrespect them by saying, hey, you're not being true. But as House MD said, patients lie. Okay, so it's a fact of life, and you have to kind of dig deeper into, okay, what do we think? And assumptions are not good. Okay, assumptions are not good, but sometimes if we genuinely think the patient's having us on here, we want to find out what could be their motive, okay? And I think if you encounter that scenario, be like let's say you tap a tooth, okay, and the patient's flinch, but they're saying, no, it doesn't hurt, okay? Be like, well, patient, you know what? I'm just really worried for you because the signs, you're not telling me that it's hurting, but it looks as though it should be really painful, and so that I can help you. Can you just really confirm that? Are you sure that wasn't even a little bit? So sometimes you want to just encourage them a little bit and explain. So a big theme of what I'm going to discuss with you now today is one of my things, which most things that I've learned in communication are always learned either from books or from colleagues or shadowing people. But this one, I believe I probably got from Zach Kara, and it's show you're working out. Okay. And I just love this so much. Okay. Because anytime I'm giving options to my patients or anything I'm explaining, I give them like the background, how I arrived at this question, how I arrived at this conclusion. There's this famous study in psychology whereby there's a long queue back in the days when there used to be photocopiers, right? There was a long queue and these students were waiting to photocopy something, right? I think it might have been a Harvard study, right? From memory. Anyway, so imagine there's a long queue, okay? And then you've got something in your hand that you want to photocopy. Now imagine you go right to the front of the queue, okay? You tap on the person who's photocopying right now, or the next person actually, and you say, hey, can I please go in front of you? Okay. And if you say that, you'd be amazed that a significantly high percentage of people actually surprisingly said, okay, fine. And they did it. Okay. But it wasn't like really, really high. Okay. But then if you say, can I go in front of you? Because I need to photocopy. Now, obviously you need to photocopy. You got a paper in your hand and you're approaching a photocopier, but just by giving them a why, it shot up to like 93%. Like it significantly made a difference in terms of the person letting you, skip the queue. And so this psychological experiment, what it teaches us is, don't just tell someone, if you actually give them a why, that actually matters a lot more. And that's kind of a lot of the basis of show you're working out. So for example, like telling someone that they benefit from a root canal potentially to save their tooth. It's like, hey, I think to save the tooth with a root canal is probably the best idea. I know it's going to take more time. I know it costs more, but the reason I came to this conclusion that if you lose this tooth, you won't have a bite on the left side anymore, and then you'll be chewing only on the right side. And over time, that can cause its own issues. For that reason, I think we should do this, rather than, I think I like to save teeth, let's do a root canal. You're just giving them a bit more context, and sometimes you try and speak their language.
Yeah, I love that. I think that is, something I do want to ask you is about terminology. And if you don't mind, just before I ask you that, kind of bringing it back a bit, when it comes to almost offering treatments, I love this idea of like giving the why, but is there like a fine line almost between doing that and almost pushing and encouraging people to take a certain treatment option? Because apparently that's like a big no-no, right? Like we shouldn't kind of just say you should do this, but you also have this option. How do you manage the wording for that, especially when it comes down to being a professional dentist and then you've got, so many legal issues involved? How do you word things correctly when you're giving options? But then obviously in your head, you probably know what the best option should be for the patient. How do you present that?
That's $1 million question. I love that because that's something I've really tackled with and a big confusion area for me. And I think I've gained a lot of clarity over the years through experience and speaking to mentors and great people in communication. And I think we all need to remember, that anything. So firstly, let's all remember, whenever you post an image on Protrusive community or anywhere you post it, right? I mean, I know that actually the agreement rate in Protrusive is pretty high amongst each other, okay? But even now, they we'll disagree with each other respectfully. What I like about our community is that we're very respectful in disagreeing with each other, right? But you ask a dentist an opinion, right? And if you ask 7 dentists, you'll get 12 opinions. You see what I mean, right? So firstly, you must appreciate that there are so many opinions out there. Every dentist will give a different opinion, which is absolutely mad to just remember. But then remember that when a patient comes to you, they are coming to you, they're seeking your opinion. They've selected you either by geographical convenience or recommendation or whatever. They're now ended up in your chair, right? So all you're ever giving them is an opinion. That's it, okay? And so remember, I know we're very international, people all over the world listen to this podcast, but our standards that we follow in the UK, and I'm sure, and we're one of the strictest regulators in the world, right? GDC. So if it satisfies us, it probably satisfies where you are in your country, which is we are allowed and we should make a recommendation. It actually says in the standards, you should make a recommendation. And so we're allowed to make a recommendation. So you're not saying anything wrong. You're not coercing the patient. You're not persuading them down a certain way by making a recommendation. But really, the question really is the recommendation that we're making, is it on a sound basis? And it should not be for profit. It should not be for your gain. It should genuinely be in the patient's best interest. So if you've got 5 different options to treat a problem, and you're not sure which one to recommend, that just means one thing. And that one thing that means that you haven't asked the patient enough questions. For example, you should ask the patient, would you like something removable or would you like something fixed? Okay. It's like playing Guess Who. You know that game Guess Who? Yeah. Right? Once you've asked enough questions, there's like 2 dudes who could be, that's it, right? And then be like, okay, well, is this option or that option? Because you told me already that you want something removable because the idea of a fix, and you want something that's going to be on this budget, and you want something as quick as possible. Based on that, it's either going to be do nothing or a denture, okay? But because of the fact that you told me that you like to chew steak, I think based on that, I would recommend the denture. It would cost this much, it will involve this appointments. The other option is to do nothing, but then by doing that option, this is the disadvantages, basically. And so I think that's a very simple way to do it. Once you've figured out what the patient's goals are by asking lots of good questions, it's just like Guess Who. You kind of know what to recommend, and you are allowed to recommend. Yes, you should give the other options, including do nothing, but it's totally fine to recommend. And I think make peace with that. And all yours is an opinion, and that's okay.
I love that. Okay, so long as that's the case, that's great. And I mean, one thing that you mentioned there is obviously about questioning. And I think, that is the way that we're going to get down to everything. But where's the sweet spot? Or is this also an experience thing? Because surely, I'm guessing that you've seen this from newly qualified dentists or even students like myself. We probably babble a lot and we probably ask a million questions and bore the patient, or we ask for too much. What's kind of the sweet spot? And I'm guessing, is it only learned through experience, or is there any kind of tips that you can give us there as always, as to not overdo it?
I think experience is a huge one. And your environment actually matters as well. And what I mean by that is, when I started my career, like most dentists in the UK, I was in NHS practice, right? And so some days I'd see, 26, 35 patients in a day, okay? And now I see like 1 patient if it's a whole day treatment, or like 8 patients or 12 patients. Do you see what I mean? It's a different flow. And so you have to become very efficient in that practice, in NHS practice. I'm not saying that that's the best way or the worst way. I'm not saying either of those things. It's just the way it is, because you are catching targets, you're in a publicly funded environment, okay? And that's how it is. And so that makes you think fast. That makes you be like, okay, well, here's the problem. Here's my differential diagnoses. I've nailed my diagnosis. Therefore, the option to this, you become very slick at doing that. And so being in that environment accelerates it. And then the difference now is I use those same skills, but I really work on building a rapport with the patient so that they really feel listened to. And I get to actually talk them through their radiograph. I get to show them the intraoral camera photos. And, once they have that done, they're just amazed, because most colleagues they've seen before may have not done that, and therefore they come to you and they're never going to want to see anyone else ever again, because the way that you explained it, the way how patient you were, how open you were to welcoming questions, and the clarity in which you explained those options in their own language without using jargon was something that they're always going to remember. So it comes with experience in a way. So that's the honest answer. It comes with experience, but you get experience of working in both those environments, a fast pace and a slower pace, and then sometimes you just use skills from either one.
Okay, so definitely experience. It seems like quite a lot of this is experience based, and so at least it's putting me in a good frame of mind that I'm not just completely failing at this stage. And
now I'm like, let's see, am I 12 years qualified now, right? Which is still a baby, right, in terms of the long career that we have, okay? So I take advice and I take the experience and mentorship from those who've been in the game for 30 years, right? And what they've all told me is that over time, maybe it's the gray hairs or whatever, but like getting patients to agree to treatments, okay? And I say that in a way not for profit, not for, case acceptance and grossing and that kind of stuff. I say it in a way that when you recommend a treatment for their benefit, for their health, right, that the patient actually values their health and goes ahead with it because that's the best thing for them. So in that kind of frame, the dentists have say that either it's because they've seen their patient for so many years, or just the way that the dentist now says it, right? When the dentist has so much experience, honestly, you don't care if the patient says yes or no. It doesn't matter, right? If you eat tonight or not will not depend on that, okay? And when you're not desperate for it and you're literally just there, as an advisor to the patient, okay? And you're like, what would you like to do? This over to you. How can I help you? Okay. When you come with that frame over time and get those gray hairs and you get the experience and you've been there before, and I think patients can smell the confidence. Okay. And so a lot of it will come from time. Maybe it's because, one of the reasons I don't dye my beard yet is because I like the gray hairs. It shows I've got experience. And so maybe it's just, they all tell me that maybe it's with experience that you don't have to try as hard. Patients actually just want to do everything you say because of you just having more experience.
Okay, you said their patients can smell the confidence. On the other end of the stick, can they actually smell the BS as well? And the reason I ask you that, there's two types of people, right? There's two types of, let's say, dentists for the sake of it. There's those that have one personality and they're true to themselves and they do it with everyone. And there's the chameleon, right? That's doing a bit of everything because they're seeing the patient and they're adjusting according to. What's your advice on that? Because again, patients aren't thick, right? And they can figure things out. So how do you approach that? What would be your advice around kind of personality and how to kind of exude that in a way that isn't BS, basically?
Again, you asked some amazing questions. I'm going to say be a modified chameleon. Okay. What I mean by a limited chameleon is because I value individuality. So I did Tom Rath's Strengths Finder book years ago. And one of my 5 strengths is individuality. So one of my core strengths is individuality, meaning that I treat the individual as an individual. I know there's protocols and stuff that we apply to everyone, but if a teenager comes or if a kid comes, I'm going to talk about that kind of stuff and I become a big kid and stuff. And it's very easy, very fluid for me to do that, right?
Nice.
And then when the sweet old lady comes, I change, I adapt very easily, right? So I think it's good to be the chameleon, okay? And when that engineer comes, okay, you talk like an engineer and you put a different frame on, you put a different mask on, right? And I think the other topic that's just very related before we cover this in a bigger way, but very related to this is the fact that we are in theatre, not the medical theatre. We are in showmanship. We are in Hollywood, baby. Okay. What I mean by that is when you have a tough day and your kids are not having their breakfast and you had maybe a tiff with your wife and then you're going to work, whatnot, and you woke up on the wrong side of bed and last night there was an issue at home, whatever, you have to forget everything. You put on this mask. Okay. When you put on those gloves, the lights are on, makeup, camera, action. At that moment in time, the patient must feel that they are the only person in the world. That's how important that you need to make them feel. I need to forget everything because we owe that to our patients, okay? So there is a degree of showmanship and turning up and putting on a performance, okay? And some people don't like to hear that, but this is what I've been taught by one of my first principals, Dr. Hapgill, and I think it's true. I think what we do is performance. And just like performers, when you act a different role according to the movie, all right? And the movie will be different every time, and the script is different every time, okay? You are still the same person. You still have your mannerisms. You still have I'm not saying change yourself. You're yourself, but you're being this modified chameleon to blend to the scenario, to blend to the individual. Now, the reason I mentioned the word modified is that because you need to draw a line in the sand and set some standards. What I mean with that is I've decided a long time ago, right, that if any patient, right, is rude or just not a nice person, or you know what, that we're really not seeing eye to eye and that we're clashing, okay? Thankfully, it doesn't happen very often, but there are some patients that it can happen to, right? I've got some funny stories I can tell you perhaps later. But, the other way to think about this, it's a long way of saying it, but when you look at your career, and then let's say you have been in one practice for several years, you'll notice that you attract patients that are similar to you, right? So my patients, the ones that don't gel with you, they'll go somewhere else eventually, okay? Or see the other dentist, okay? My patients are bubbly, my patients are talkative, and they're very much like a representative of me. And that happens over time. You'll notice, and that's a sign of you're doing something well, and that's a sign of happiness. There's less, you get along with your patients. It's a gelling that you have basically. And so the reason I mentioned that, and going back to, I decided a long time ago, there's certain type of patients that, I still have a duty of care to them, and I'll still make sure they're out of pain and stuff. But if I'm going to be doing any elective treatment, right? If I'm going to be doing a smile makeover, if I'm doing any orthodontics, if I'm doing a full mouth rehab, I'm doing a tooth wear case, okay? I'm not going to touch that, okay? I'm going to say, look, maybe it's better you see someone else for this kind of work. Right? Hello, YouTube Protrusive. I know you're watching on YouTube, and I hope you enjoyed this episode so far. But I wanted to highlight, in case you don't know yet, we have an amazing viewing experience on protrusive.app, our website, our network, our platform. So I just want to spend a minute to show you what this looks like. On the left side, you see the navigation, and when you join the app, you get a 1-minute video tour of the entire network. Now, in terms of where the magic happens, that's in the Protrusive community, because you might come for the content, but you'll stay for the community of the nicest and geekiest dentists in the world. We have all these polls, we have a chat group, there's always active chats and dentists helping dentists. And really what I wanted to do is create a really supportive environment that's not like the environment we have on Facebook, and it's built on the values of niceness and geekiness. If you are nice and geeky, you belong here. Now, to make this a safe space, we have a manual process of approval. We actually verify that you are a dental professional before you get in here. So we have hundreds of applicants a day. So if it's been about 2 days and you haven't heard anything, either something's in your junk or you need to reach out. If you're still waiting to join your tribe, email marie@protrusive.co.uk. That's MARI@protrusive.co.uk, and she'll investigate what's happened. Now, all the videos you have on YouTube are also on here, but you actually have some extra ones for free that you don't have on YouTube. So you get some bonus content that's not on YouTube. And actually for the future, I'm not taking things out of YouTube, but some things are not appropriate for the wider public, and I want to sort of safeguard that information, which is like dentist talk, if you like. So that's why a lot of the content is only here and not on YouTube. So you're kind of missing out if you're not on here. That's why I'd love for you to join there. And if you join one of our paid plans, then what you get is access to the CE quiz like this one, and you can get CPD or CE certificates, and also you get our premium notes. So these are a great aid memoir or revision for an episode to really cement your learning. And whilst we have ads and YouTube places ads on YouTube, we don't have that on our network. So for the paid plan, you get to see all of the premium notes without any of the ads. And of course, you get to support Team Protrusive and help us to continue what we're doing. I'm just going to gloss over the Protrusive Vault, which has all our infographics and downloadables. These are all our masterclasses at this moment in time, and we're always planning to add more. And if you look at them, there's about 1, 2, 3, it's about 7 of them. But actually, if you look at the replay section, some of the live masterclasses that I've done and some of the training that people pay for on other websites is all on there, included as part of the masterclass subscription. And if you're a student, don't fear, we have a special section for you with all the student notes, which anyone can access. So for example, here is one on exodontia. So it's all there waiting for you on Protrusive guidance. Please head over to the website, which is protrusive.app. Make an account on your browser. This could be Safari, Chrome, however you want to do it. And once you've made your login, then you can download the iOS or Android app and then log in through there. So the reason to make the subscription primarily on the website first is that you get access to a free trial, which you don't get get if you do make an account on Android, iOS. If you make it on the website, you get access to the free trial, and you get our best price if you sign up through Protrusive.app. So our best deals and free trials are only on Protrusive.app. Of course, we always put the link below in the description. And thank you so much for enjoying our videos on YouTube. But it's now finally time to level up your experience. Back to the episode. I rather see the patients, okay, that we truly have a connection, okay? Because if we don't have a connection, I'll get them out of pain. I'll still be courteous and respectful of them. But if I genuinely do not think that we will gel together, okay, there's someone else that will do your work, but they'll gel much better with that patient, with that dentist, sorry. And so, there is teamwork. There are other dentists out there who will gel better with other patients, and let the universe find that solution for them.
I like that. And then obviously you mentioned there about rude patients, and then you don't try to distance yourself from them. As students, especially when we're yes men, let's be fair, right? We don't really have the power to tell people to like do and go to another practice. How do we deal with it? Because we're not ever seen as dentists, right? We're seen as understudies, and maybe we don't get as much respect as fully qualified practitioners. What advice would you give to students in my position that might come across a tough day where somebody's not respecting us, treating us like doormats? How do we kind of put that professionalism back into that workplace between patient and dentist, and then not let it affect us mentally? Because let's be fair, we are probably the most fragile creatures, right? When we're students, because any critique and suddenly we're like, oh, we're in the wrong profession, we're not good enough, yada yada. How do we deal with difficult patients? What would be your kind of communication tips for that?
I mean, that's brought so many thoughts to my mind. The first thought is, they say that when you go on a first date with someone, right, and you're in a restaurant, okay, you look at how they treat the waiter, yes, right? Before you think about, okay, should I go on a second date? Should we eventually come in a binding relationship with someone? You look at how they treat a stranger. You look at how they treat other people. That tells you a lot about them, right? And so in a similar vein, some of my receptionists will tell me that, Jazz, the patients are so lovely to you, but when they come out to us, they're really rude to us. And that's important information, because that's not nice. I mean, if your values are such that, that everyone deserves to be treated nicely, then that, you need to record that in your mind and just be mindful of that, because sometimes patients can turn. So for me, like, niceness is a imperative value. One of the reasons I market Protrusive Guidance as the home of the nicest and geekiest dentists in the world is because I genuinely believe that, if you're there just for the free downloads and you're not actually want to contribute, not actually be nice to one another, then, you don't belong in Protrusive, right? I actually want a collection of just the loveliest humans first, then dentists. So I believe in that, and I truly hold that, right? However, having said that, to answer your question, you as a student, right, sometimes they'll be rude to you, but ever so nice to the professor, to the tutor, and I'm sure you will experience this, okay? And so that tells you a lot. But in your scenario, you've got to get through it. You've got to suck it up, buttercup, be respectful, be courteous. You've got to get through your dental school training, right? But when you come out in the real world, if you come across patients who are rude to you or rude to your staff, you need to have a policy and a protocol in place, okay? So again, we have a duty of care to these patients, okay? And we will get them out of pain, and we will speak nice to them as best we can. But you have to think twice whether you really want to make this patient, are you seeing eye to eye? Have you got enough rapport? Because you need rapport, because we don't have 100% success rates. If you tell a patient that there's a deep filling and there's a crack in your tooth, you didn't put the caries there. You didn't put a crack in the tooth. The patient came with that. If they don't own that, right, and they'll be quick to blame you, the dentist, okay, do you really want to treat that kind of patient? Do you want to take that patient on? Not really. So you need to make sure that you see eye to eye with that patient, okay? And then over time, you'll find that if you adopt this mentality, you will genuinely attract the kind of patients that share the same values as you. Your patients become a reflection of you.
I love that. I absolutely love that. I think that's kind of connects with what you said before about, over time, you're going to just have people that are so pretty much you versions of patients. And over time, you're just going to build that kind of client base or patient base, whatever you're going to call it. I'm looking forward to that. I'm looking forward to just seeing loads of navs eventually. That'll be quite fun.
There'll be different forms of navs,
Yeah.
The old lady with a slight navism and whatnot. And those patients that, they don't genuinely feel that connection. And the feeling will be mutual. You don't have a connection. And I'm very much coming at it through a lens of, general dentistry is really fascinating. Like, you go to your doctor, you go to your GP when there's a problem, okay? And every time I go to a GP, I'm seeing someone else, right?
Yeah.
We in dentistry are such a unique and beautiful position, right? Like, one of the hygiene therapists retired recently, right? And she's been seeing one of my patients. I've been seeing this patient for 5 years, but she was seeing that therapist for 30 years.
Oh,
and
wow.
on their last day, they both shed a tear. They both cried, okay? Why they cry? Because and I asked her, tell me more about that, right? And she said, well, she was there when I gave birth to my first child. She was there when this happened, she's been a constant in my life and now she's going, and we actually, if you choose to go into general dentistry, family dentistry and be in a practice, which most of us will do, we cannot, honestly, underestimate the power of this. To build a relationship in dentistry is so powerful. And when you connect with the patient, right, and you have that lovely rapport, they will follow you around, okay? And that's the best kind of scenario, right? And the patients that you don't gel with, you're still going to be respectful, you're still going to care for them, but you'll find that eventually there'll be what we call an attrition rate. As soon as they have to move a mile down the road, they won't come back to you, and that's probably for the best. That's probably for the best, right? They only came to you because of geographical convenience, and that's all. And that's okay, okay? You were there to serve them and help them, but the kind of patients that you genuinely have a connection with, so that's what I mean. Over time, you will find that the patients that you held and retain are such a great reflection. And so many dentists tell me that they love their job and they love it more than ever before, now that I've been in one practice for 20 years, because it genuinely feels like a chat. They genuinely feel like a patient's coming for a chat, and when something goes wrong, like a tooth, a bit large filling that happened 18 years ago now breaks down, and you say to the patient, okay, I can help you. This will be a post crown. We can do that. This is how much it's going to cost. And the trust is there. And they'll be like, yeah, sure. When can we book in? Because the trust is the currency that we deal with. Not economical. It's all about trust.
I love it. This is just sounding like a barbershop to me now. It's like, the going in there like almost.
I don't know. I would never know. I've never been to a barbershop.
You're missing out. I'm telling you. It's where all the guys get together and have their secrets. But I like this idea, this concept. I think that longevity within our career, it's rewarding more than just from a financial aspect. But there's so much
big time
kind of interpersonality within there as well. So that's amazing. I mean, going back a few steps and kind of trying to weave this together, so to speak. You spoke about language, right? Which is super important. Students make this mistake all the time. We speak to our patients as though they know everything that we read, right? So we're talking to them about, you might have a periapical lesion here, we did this and yada yada, and you need X, Y, and Z, and they're just sort of sitting there like, what the hell are you talking about, right? It's very easy to do that as students. Is this something that you see progressing into dentists that have qualified and they still do it? And what would be your advice to, I don't want to use the word dumb it down, because we're not trying to say our patients are dumb, but how do we almost normalize the vocabulary with patients? What's your advice for that?
Yeah, great question. And the answer is yes, there's jargon everywhere in dentistry. And I've seen some really qualified dentists, like 20, 25 years out. And then the way they're talking to the patients, like they're literally, I saw a prosthodontist look at a patient in the eye and tell the patient that in lateral excursion, when you go to the left, these teeth are touching. Like, there's only a very niche engineer type of patient that will understand what that means and actually the ramifications of it, right? A lot of dentists might not even understand. So, like, I've seen this happen, right? And they're literally saying, like, you have a periapical infection. And even just like, I know a periodontist, right, at uni, and he said to a patient, and is this contemporaneous with what your dentist said? And so I'm not saying dumb it down, but like, is that really, appropriate? So if you feel as though the patient has that level of language and you've sussed that out, then absolutely, because I'm a big believer in that modified chameleon, and therefore, I'm going to speak like this, innit? If I see someone, who's from the street, I'll be like, bruv, listen, your tooth needs to come out. And and very much, I got out that, right? And that's fine, okay? And they respect me a lot, and we get it, okay? I don't actually do it in that extremity. I was a bit of a dramatic effect there. But I'm very much like, if the patient wants to fist bump me, I'm going to fist bump them, right? So you got to really meet them where they are. And the best person I saw do this was Raj Patel in Sheffield. Like, when he saw a patient who was a gardener, right? He would literally describe, just like that, in such a wonderful way, he would describe everything that he was doing in dentistry, like in gardening terms. If you had a builder or plumber, it was the most magical thing ever. And I learned a lot that day seeing that, right? So try and speak to the patient on their own terms, right? So for example, if you have a teenage girl, right, which was a real world scenario, teenage girl, good looking teenage girl, and she was thinking that she had an ectopic canine, and she said, you know what, I don't want braces, I'd rather have it out, and I'm accepting of this. And then he really spoke her language and said, look, fair enough, it doesn't bother you now, but when you're 30, when you're 40, think about your long-term future, and when you smile, and forgot what he said now, wedding day or whatever, like, try and just help them see the long-term connection and about their friends and stuff, and bringing it all in. And the way he spoke to her was like, yeah, you know what, and she was there with her dad that day, and she was like, yeah, you know what, you're right, I think I should get the braces, and I think that's the best for me. And he made her realize that by really connecting with her. And so when you connect in the patient's own language, and when you connect with someone's own language, then it's easy to actually avoid periapical pathology. It's like, look, you see this black thing over here? To most people, I say that's infection, okay? To the guy off the street, I might say, listen, that is mush. That is mush in there. Trust me, you want that out, okay? And they are very receptive.
Okay, so this is going back to this modified communion thing over and over. I feel like this is the theme. So I'm going to definitely have to take this in and just adjust depending on the patient. This is amazing information. Thank you very much. My kind of future question, because obviously we're not there yet, might be a great way to wrap up to you, but finances, payment, how the hell do you do it? Like, I find it weird to ask my mate for that fiver back, right? How do you go and speak to strangers and say, this is the treatment options that you got available and it's going to cost you X? I don't know how you do it. Do you do it at the beginning? Do you do it at the end? Do you get someone else to do it for you? Like, do you have a card reader in the surgery and you say, pay up now? Or do you send them away? Explain, because this, I think we all have sleepless nights as students thinking about this. So please do enlighten us.
I'm laughing here because literally, like, everyone, like, this theme has been a big one throughout my career, and I'm at a comfortable place now with my fees and stuff, and I'll tell you how I do it now. But over the time, I tried every method. Like, I tried this method whereby, because I hate to talk about fees as well, so I'd be like, okay, Zoe will tell you the fees, and I just look away, and Zoe would like, okay, so and she'll do the work. And some people have treatment coordinators, then so they never have to worry about talking about fees, okay? And so for me, I think it's a bigger thing here, right? And a lot of this, Lincoln Harris inspired me, and some of this my own little masala here as well, which is it's a money mindset thing, okay? I come as a refugee from Afghanistan. Money is not something that was very prevalent when growing up. And then coming into dentistry where, me coming in, right? And my parents would never spend the amount I would then be charging for restoration. My parents wouldn't have that kind of money. Right. And then so knowing that and knowing, the kind of, it's like the relationship we have with your parents and how their money mindset goes into you. And for me, I remember, and I talked about this in another podcast episode, right? A really, really sad but funny thing. A patient who was also a refugee, actually. So this patient's a refugee, okay? And I came in when I was 6 years old, and this patient came from Afghanistan like a few years ago, right? And then I took his tooth out, and then he asked me, how much does it cost to replace something here? And I went through all the options and said, okay, how much is an implant? I said, well, it's, about £2,500 at that point, I said, right? Probably more than that, obviously. Now it's definitely more than that, okay? And I remember saying it a little bit like, yeah, it's quite a lot of money, That's how I said it. And he literally just started to laugh. Like, not like in a rude way, but in a genuine tickling, like, hysterics. Like, that's hilarious. Are you kidding me? That's hilarious. It can't cost that much. Like, it was that kind of laughter, right? You know what I did? I started laughing with him, because even I was like, okay, and so that was like when I was like in my DF 1 year qualified, right? And so I had a huge money mindset issue, okay? Because, I didn't have money in my life. And therefore, it was difficult for me to talk about money with my patients, okay? When that kind, the kind of treatment plan to do a post-crown and this denture was way more than what was in my current account at that point. And so there was a money mindset issue. And I think that's normal to have that. If you don't come from a place of money, I think it's normal to have that. And so over the years, it's not just that because I accumulated more money and had more income. It's generally I worked on my money mindset. And I really, read some things. And really, money is a flow of energy, okay? And when you become grateful of every time you see money leave your bank account, you need to look up and say, thank you. Thank you for allowing me to be in a position that I can pay for something, okay? Yeah. And then when money comes in, be like, again, look at the universe, say, thank you, okay? Money is just flowing in, money is flowing out, money is just energy, and that's all it is. And so when you then realize that actually you are totally worth it, okay? Because you can go to a fancy place and there could be a wardrobe, okay? A bloody small wardrobe for £40,000.
Jeez.
And people will buy it. And they produce it and people buy it, okay? And then when you realize that actually we are not in the money business, we are in the value. It's the value that you can bring to someone, okay? What we're selling is health. We're selling health and longevity. If someone can chew better and digest better, once you realize that we are in the health space and there's nothing more valuable than that. Now, there are some patients who genuinely cannot afford your fees, and that's okay. So when they say no, don't take it personally, okay? If someone genuinely cannot afford it, okay, then that's fine. Now, just because someone has got £50,000 in their bank account, don't think that they're going to take your £2,000 treatment plan. Yeah. Don't think that it's a no-brainer for them, because they may not value it. So either you haven't communicated the value, or genuinely the patient will, has a value issue, basically. And so the top tip I give here is fix your own money mindset issue, because that's a big part of it, okay? Once you fix your money mindset issue, it becomes easier to talk to. And then I tried all those various ways, never was comfortable talking money. But once you overcome your money mindset issues, and then I had an experience whereby the patient went down and they felt as though I didn't communicate the fees properly, okay? And if a fee is a surprise to a patient, then that's not good either, okay? So now I'm in a place now where I'm very open and honest and very direct with my fees. Like, okay, so that we can get this done, the total fee will be, £4,500. Okay, and I say it very confidently. I don't look away, I don't blink, I say it very confidently. And sometimes what worked for me in the past as well, and perhaps it's worth mentioning because it might help someone, is one of our values in this practice is to be transparent in our fees. The total fee for everything is £4,500. This will include all your appointments, the lab work, and by the time you come to the end of it, you'll have paid that amount and you'll get this work done, basically. And so just to explain that, so that we are transparent with our fees, this is how much it costs, this is what it includes, is this something that you'd like to go ahead with, or do you have any questions, that kind of stuff.
I like this. I think the money mindset is huge as well. It's how we perceive things. So this is all going in. I'm going to have to probably do some role play with a few of my mates.
Yes, Nav, you're so right. Role play is really, really important. Okay, and wow. So I'm listening to a book at the moment called Psycho-Cybernetics. It's from like the 1950s. It's like the godfather of self-help books, right? Huh? And so it gave birth to the sort of self-help era, basically. Okay. The Tony Robbins of the world, etc. And really, what it talks about is the power of role play and power of imagining yourself. So if you imagine yourself, right, being in the clinic, looking confident, being kind and courteous to the patient, and with a smile, be able to say, well, actually, it's going to cost this amount. And the patient saying, thank you so much. I can't wait to get started. Okay. And that visualization and then role playing in your head, because here's a fascinating thing, right? Your brain does not know what is real and what is imagined. Ooh. So if you literally imagine yourself in a dark room, okay, and all like you see ghosts and stuff, right? And you'll start to sweat. You'll actually like start, and it's a terrible example, which is the first thing that came to my head, right? But like your nervous system will actually put depending on how vivid your imagination is, and how big your fear is, you'll start to sweat, you'll have a palpitation. Your brain does not know if that was real or that was fake. So the other thing is, like, for example, there was another experiment whereby these people do free throws in basketball.
Yeah,
right?
yeah.
They try and get the free throws in, right? So group 1 does free throw training every single day. So for 21 days, every single day, they will practice. Okay, every single day. Okay, and then group 2 only practices on day 1. Okay, and then they get tested at day 21. So group 1 practices every single day, and then their test is on day 21. Group 2 only practices on day 1, and then they get tested on day 21. Between day 2 and day 20, they did no practice. Uh-huh. And group 3, here's a fascinating one, right? They practice on day 1, they do a test on day 21, but in between, they don't actually practice for real, they practice in their brain. They imagine practicing, okay? Now, the worst group was the one that didn't practice at all.
Yeah.
The best group was the one that practiced every day, but only by like a whisker, because the group that imagined getting the ball in, right? They were literally only a whisker behind, okay? And they were significantly better than the group that didn't practice. And so what this experiment shows us, athletes do this all the time, the power of visualization. Every time I have to give a lecture somewhere, okay? Like recently I was teaching inclusion in Norway, full day, like half day lecture. I was a little bit nervous, but I literally used the power of visualization. What's my face going to look like? How am I going to be dressed? How am I going to deliver this piece of content? And that really helps me a lot. And so going back to your point, if anyone's struggling discussing fees, the power of visualization, the power of role playing, even you don't actually need to really do role play. You can role play in your mind. You don't even need a mirror. We can do the mirror, but classically do. But if you imagine you doing this and you imagine yourself communicating in the way that you like to portray yourself, then that's going to happen.
Oh, I love that. Do you know, when you were saying all that, I just remember something from ages ago. I'm pretty sure David Beckham used this because it was once on a documentary or something, and they were mentioning that he does a lot of visualization, and he just repeats.
Athletes are renowned for it. The top athletes all say in golf, in various sports, in top athletes, they do this. They visualize exactly what they're trying to do. And the brain doesn't know if it's real or fake. The brain is actually figuring out. Even there was an experiment whereby the people are lifting weights, okay? And then people just vividly imagine lifting the weights, and they actually got stronger, and they're able to do, yes, they actually got stronger. Okay, this is a real thing. They actually gained muscle mass. There's a limit to that, obviously, but it's just fascinating to see that actually, compared to doing nothing, but just by visualizing, you actually grew a bit.
That's insane. That is actually power of the mind. Okay, I love this because this is going to probably help me in more than just the financial and asking people for, or telling them what their costs are for dentistry. More so,
look, the patients need to know how much it costs, right? Like they need to know, and so don't be embarrassed about the fees, basically, because that's very normal to feel that way, especially from for a money mindset issue like I used to have. So be proud of your fees because you are providing an incredible service, incredible value, right? And so one thing that helped me a lot as well is because when I was charging someone, let's say £300 for a restoration, okay, it's a restoration, not a filling. A filling is what goes in a sandwich, by the way, right? So when I charged £300 for a restoration, okay, At that point, I was questioning, oh my God, I'm charging this much because that's how much the practice charges. But in my own mind, it's like, is what I'm delivering actually worth £300? It was a self-doubt, right? And so one of the reasons I went on so many courses, like my first 5 years was course after course after course, okay? Now, if I'm charging for an hour of my time and I'm charging, it's a complex MODB, complex build-up, okay? And I'm charging £450, okay? I think I'm cheap. I can charge more than that, and I'd be more, and I'd be happier, because honestly, the clarity in my protocols I have, I know my patients are not going to come back with post-op sensitivity. I know that I'm using air abrasion. I know I'm doing this. I know their occlusion is going to be on point, right? And I'm going to serve them well. I have this much, and please, I don't want anyone to see this as arrogance or anything. I really hope it doesn't come out that way. It's conviction in my training and my belief that I'm going to really help my patient, so that now I come to a point where I'm very easy for me to charge that amount, because I truly believe, I've done so much training. I'm ready for this. I can't wait to deliver you the best restoration you ever had.
I love this. I don't want to take up too much of your time here, but I do have one question I want to ask you off the back of this, right? Surely there must be a time where sympathy kicks in. I can almost imagine myself being an idiot and feeling sorry for patients, and sometimes being like, oh, it's all right, I'll just discount that, or that's all right, I'll just do it for free. Does that happen? Is this just me? Is this everyone?
All the time.
How do you do that?
It's like what we call a neurofiscal drag, right? So early in my career, let's say the figure in my mind is £150, because that's how much it should be. By the time it comes out of my mouth, it's lost £30, right? It's 120. Right? Now, here's a stupid thing, Nav, right? You say to the patient 120, and they're still gonna be like, oh, 120, that's too much, right? Yeah, and they didn't even know that was 150. You discounted it. The worst you could do is you give a discount, but the patient never knows that you got a discount. That's the worst thing. That's the stupidest thing ever.
Oh, I'm with you.
Like, literally, you gave them a discount, and they don't even feel that. And so, what was the point? You could have said 400. The reaction would have been the same. Okay, so really, yeah. I mean, it's normal, especially from my money mindset background and my refugee background. I felt very sorry for patients, and I discounted my treatment plans left, right, and center. I don't so much anymore. I'll tell you why. As an associate, if you do the maths, if you look at profitability of dental practices, when you give a discount, you really, really screw yourself over, but you screw your practice over a lot, like in a massive way, right? They have so many overheads, materials and everything. It's an injustice, okay? Because you got to gross a certain amount per hour for them to keep the lights on.
Yeah.
And so you have to really remember to be respectful to where you work and your principal. And it is a business, because if there's no money in the business, there's no practice anymore. There's no job for you anymore, okay? And so it's important to charge what you're worth and charge the right amount, okay? But it's normal to want to give discounts, and I get it. But over time, when you really appreciate, that you are delivering a really good service, and the fact that you need to be respectful to who you work for, okay, then I think when you realize that, then I think something clicks. And then whilst you can be empathetic and sympathetic with the patient, look, and if someone has told you, look, that's a lot of money, it's like, look, I appreciate lots of money, and how can I help you? Well, you can do it in phases. There's finance plans. If not now, then we can always save up and do the right thing next year. We'll still be here for you. And just be there to, if someone genuinely cannot afford it, you give them the options and financing and stuff, or come back in the future. Sometimes, John Coyce famously said this, like, just because you don't want to do the right thing doesn't mean that I have to do the wrong thing.
Aha, I like that.
And so sometimes if you're going to make the situation worse for someone, then say, look, it's better you actually do nothing and save up and then come again next year, and then we can help you better. And I genuinely think that's the best thing for you. And so again, it's one of those things now that comes with experience.
So we started with experience, and I think we're ending with experience. I think this has been extremely enlightening, and I'm sure everyone else who's in my position and probably even qualified is probably going to love this. So Jazz, seriously, man, as always, absolute pleasure. You smashed it, man.
Nav, thank you so much. Honestly, your questions were absolutely sick. They're amazing questions, so I really appreciate it. And we're definitely going to bring you back on to do more of these. I think you and Emma bring a different flavor, which is wonderful. I think that synergy is going to be amazing. And maybe we'll have you both on together as well one day, right?
Amazing,
so that'll be good. But we all wish Emma the best with her exams. And you got any exams coming up, Nav?
I'm still a couple of months away from it, so I'm still good. And it's year 4, so the hard stuff starts in year 5 and then 6. So I'm taking it easy.
Great. Well, I can't wait to publish this. And please plug yourself. You got some stuff out there for dentists and dental students as well. Please tell us more about your channels.
Yeah, so I've got a YouTube channel called The Stu Dent. Just trying to be cool there and mix dentistry into it somehow, where I'm covering my journey as a dental student, what we cover as dental students, the highs, the lows, and vlogging my time here in Slovakia as well. So if anybody can find me on YouTube, or I'll send you the link, you can add it.
I'll put the link. Please do subscribe to Nav as well, guys. As you can see, his energy is brilliant, and he's very giving and sharing. So be supportive, and you can message Nav on Protrusive Guidance. He's on there. He's very active, and so we're very grateful for that. So Nav, thanks so much for your time as well. I'll see you in the next one as well.
Lots of love, man. Thank you very much.
Well, there we have it, guys. Thank you so much again and again and again for listening to the end. If you are on the app, scroll down below, answer the quiz to claim your CPD certificate. We are a PACE approved provider for those of you who call it CE. And if you are new, thanks for joining us today. Please do give us a subscribe and a thumbs up if you enjoyed this episode or you learned something. What a wonderful job Nav did today. So well done, Nav. Really, really great questions. I thought you really helped the flow of this episode. I want to thank all of the Protrusive team, especially Jan, Erica, Chriselle, Marie, Julia, and of course, Nav with everything he's doing. Remember that our community Protrusive guidance is not just for dentists, it's for dental students as well. In fact, we have a whole little section for you guys, including crush your exams. There's all these notes that Emma has produced, and they're stacking up really nicely at the moment. From indirect restorations to dental materials, there are loads of student-friendly notes ready to download. Just make sure if you are a student, you email student@protrusive.co.uk with your proof to unlock some hidden areas. Thanks so much again for listening. I'll catch you same time, same place next week. Bye for now.